New in theaters, Concussion. It follows a pathologist who discovers a pattern of brain damage in football players. The movie stars Will Smith and follows his character's struggle to bring attention and get something done about this problem. This morning, we have Dr. Frank Dawson, the director of MedStar Franklin Square Sports Medicine. He is here to talk about concussions. He is also a team physician for the Ravens, so you understand this topic very well. Thank you so much for coming in.
Thank you for having me.
How often do you see concussions just day to day within a season? Is this as common as we're hearing?
Absolutely. I would say in my office I see at least 3 to 5 cases every single day, and on the field, of course, we see it fairly frequently as well.
Does something need to be done, in your opinion?
In my opinion, yes. And one of the good news and the good points is that a lot is already being done. Awareness is a very important thing. And one of the differences between when I played high school sports, for instance, and now is that the awareness has really increased. And movies like this do help that.
What are we seeing as far as long-term damage? When we think about the reasons why something needs to be done, is this affecting people years down the road?
Absolutely. In cases where the concussion goes misdiagnosed or undiagnosed, especially when the athlete is allowed to return to activity too soon, you can see long-term effects. And the effects of concussion are really broken down into 4 categories. You have physical effects, mental or cognitive effects, emotional effects, and also another category, sleep effects.
And how common is that you would have those long-term effects?
It depends on the sport or the activity somebody's involved in, whether it's their occupation or whether it's a contact or collision sport. And really it is based on being back to baseline and asymptomatic before you return to that activity. And one of the differences now is that we go through painstaking steps to make sure that an athlete or an individual is absolutely symptom-free before they return to a dangerous situation.
There's a lot of people on the other side of things saying they're worried that all this awareness maybe is for nothing and that it's going to destroy football and that football is going to have to end from here on. What would you say to those people?
I say to those people, you have to remember that injuries can happen in any sport. And so, for instance, if you hurt your knee or broke your ankle, you'll be out for 3 to 4 weeks, maybe 6. You have to afford your brain the same courtesy. It's many more complicated aspects than your bones. And if your brain is injured, you have to be patient with it. You have to make sure that there is no rush. So over-awareness is a really good thing when it comes to a brain, especially a developing brain.
Oh, my goodness, yes. Let me ask you this. If you would take that time off and you take the bench for 3 to 4 weeks after a concussion, would you be less likely to see the long-term damage down the road?
Absolutely. So in a younger person and in a professional athlete, we always go through a 5-step or a 5-day return to play protocol. So if the person is asymptomatic the next day and passes through the 5 steps, then they could return in 1 week. However, if they're not asymptomatic, you have to make sure that they're 100% symptom-free before you start those steps. And sometimes that can take several weeks, especially in a younger patient.
Interesting. And we concentrate on football a lot because I think there is a lot of hard-hitting things, but this can be, and so many other sports are just life.
Absolutely. In my office, treating a lot of adolescents, high school and college athletes, I see as many concussions from football as I do from soccer. I see quite a few concussions in cheer and gymnastics. It's really important to let people know this isn't just a football issue, and if you have loved ones participating in sports that are contact, collision, or fall risk, you always have to be vigilant.
So we know that there's certainly awareness right now. Do you think there will bring change?
I think there will continue to be change. If you look at the last 10 years, there has been so many developments in the care of concussions that I would expect that trend to continue. And the things that we know now have really aided us in caring for these athletes.
Very interesting. Dr. Dawson, thank you so much. Happy New Year.
Thank you. You as well.
Appreciate it.